Assalamualaikum. My name is Muhammad Ali Haider, and today I will deliver a lecture on pharmacology, lecture 1, and that's my name presented by Muhammad Ali Haider. Pharmacology can be defined as study of substance that interacts with living systems through uh, chemical processes, especially by binding to regulatory molecules and activating or inhibiting normal body processes. These substances may be chemical administered to achieve a beneficial therapeutic effect on some processes within the patient or for their toxic effects on regulatory processes in parasites infecting the patients. Application in toxicology, such deliberate therapeutic applications may be considered the proper role of medical pharmacology, which is often defined as the science of substance used to prevent, diagnose, and treat disease. Toxicology is a branch of pharmacology that deals with undesirable effects of chemical on living systems from individual cells to human to complex ecosystems. The history of pharmacology. Prehistoric people undoubtedly recognized the beneficial or toxic effects of many plants and animals materials. Early written records from China and Egypt and the tradition of India list remedies of many types, including a few that are still recognized as useful drugs today. Most, however, were worthless or actually harmful. In the 1500 years or so preceding the present, there was spasmodic effort to introduce rational methods into medicines, but none was successful owing to the dominance of systems of thought that purported to explain all of the biology and diseases without the need for experimentation and observation. The history of pharmacology. These schools propagated bizarre notions such as the idea that disease was caused by excesses of bile or blood in the body, that wounds could be healed by applying a slave to the weapon that caused the wound, and so on. Around the end of the 17th century, and following the example of physical science, reliance on observation and experimentation began to replace theorizing in medicines. As the value of these methods in the study of disease becomes a clear, physicians in Great Britain and on the continent began to apply them to the effects of traditional drugs used in their own practices. Thus, the material medica, the science of drug preparation, and the medical use of drugs began to develop as a precursor to pharmacology. However, any real understanding of the mechanism of action of drugs was prevented by the absence of methods for, and even more by the lack of methods for testing hypotheses and about the nature of drug actions. In the late 18th and early 19th centuries, Francis Magnani and later his student Claude Bernard began to develop the methods of experimental physiology and pharmacology, advances in chemistry, and further the development of physiology in the 18th, 19th, and early 20th century laid the foundation needed for the understanding how drugs work at the organ and the tissue level. Paradoxically, real advances in basic pharmacology during this time was accompanied by an outburst of unscientific claims by manufacturers and the outburst of scientific claims by the manufacturers and marketers of worthless patient medicines. Not until the concept of rational therapeutics, especially that of the controlled clinical trial, were reintroduced into medicines, only about 60 years ago did it become possible to accurately evaluate therapeutic claims. Thank you very much. Take care. Bye.